The establishment of a human leukocyte antigen HLA lab to support transplants in Guyana is being hailed as a significant milestone. Located in the National Public Health Reference Lab, the facility is expected to bolster transplant capabilities by providing essential HLA testing locally. Importantly, this test that is currently done overseas and is costly will be free of cost and results can be expected within 48 hours. Dr. Shanti Singh Anthony, who is the chair of the Human Organ and Tissue Transplant Agency, HOTA, explains what HLA testing means.
Which really checks to ensure that there is no conflict between the donor and the recipient, and that in fact there's good compatibility, and so that when the organ donation and transplantation happens, that there could be the minimum amount, preferably no complications as a result of the transplantation.
So this is the Luminex 2000. This is where we process the HLA samples. We will be doing for this process, we'll be doing the HLA typing and the HLA screening. So first, when the sample comes to the laboratory, it goes through a procedure of extraction. That procedure probably takes about 20 minutes. From there, we make up a mixture and it incubates and comes to the machine. When it comes to the machine, this is where we do the typing and the screening.
But certainly the HLA lab is a big milestone in terms of the transplant program. What happens now with living donation and transplantation in the absence of a lab is that the patients would normally send their samples to Miami. And so somebody who is requesting a transplantation now and is eligible based on all of the medical examinations and so forth, and would have come forward with a donor who is also eligible, and the determination is made that a transplant could happen preliminary, then the samples are taken for compatibility, the HLA testing and compatibility, and that's sent to Miami. That's the current arrangement, and that's sent to Miami. It is pretty expensive, and it's the patient who bears the cost for both the recipient and for the donor as well as the recipient.
Dr. Singh explained that HOTA has made significant progress in training and building the capacity of clinical staff at the Georgetown Public Hospital, the only institution currently certified for transplants in Guyana. The agency has also developed standard operating procedures covering key requirements and protocols before, during, and after transplant procedures.
And our mandate really as the agency is to ensure that organ donation and transplantation happens the way it is supposed to happen and is described in the Act. And so our mandate is to ensure that organ donation and transplantation is ethical, that it's transparent, and that it's really aligned to what the international guidelines and policies are and aligned to what is in our Act. Transplant it's very technical, and so it requires a high level of competency among our human resources. And so we have built capacity at Georgetown Hospital, where officially designated is a transplant coordinator, and by law that designation is made by the Minister of Health. And so a transplant coordinator was appointed last year, but for that person to have been appointed, we invested in training and certification.
Beyond the establishment of the HLA lab, the agency has already worked on defining policies for organ allocation and a waiting list policy.
So the discussion that's currently happening is how can we now put together a waiting list of people who can then get a transplant done in the future. Building a waiting list is not just necessarily having a list of people who are on dialysis or a list of people who have chronic kidney disease, but a waiting list means having a list of people who are eligible, but being able to manage that list, meaning that those persons will have to, as they're on the waiting list, will have to go through a medical evaluation on a regular basis. We have recently, as an agency, conducted an assessment to see what are some of the other critical things that have to be in place for a very robust, high quality transplant program. And so there are like a number of other things that we're working on. One of them, for example, is being able to do kidney biopsy and being able to, once the biopsy is done, to be able to send that to the pathology lab and have a good readout of your kidney biopsy.
While the current focus is on living donor transplants, HOTA is getting closer to conducting cadaveric or deceased donor transplants here in Guyana. For Newsroom, Isanella Patwell.